Excellent. Thank you, Simon.
Chairman, we are now live.
Simon, on the latest government information.
Yeah, thank you, Stuart. I'll just pause you there. So
we're now live, Chairman.
Yep. Thank you, members of the public who may be listening in to this, the first of our local Outbreak Engagement Board public meetings. On the board this evening, we have Wendy Pereira, our Assistant Chief Executive. We have Simon Bryant, who is our Director of Personnel, and will have the latest information for you regarding the COVID situation. We have Councillor Claire Mosdell, who is responsible for public health, as well as adult social care, homeless, and a range of other areas. And we have Councillor Stuart Hutchinson, who is focused now on our COVID recovery plan. And you have myself as council leader. This is a really important board. It is determined that the island will put us in the place that we are at the moment and stay there, which is, as you will hear, a relatively low situation, but so important that people don't get complacent. So, with item 1 on the agenda, can I ask if any members have got any interests they wish to mention which are not already covered on their council interest record? No?
Yeah, no, nothing.
Okay, thank you. If I move to item 2, and this is a report on the local Outbreak Engagement Board. Stuart, I think you're going to start, and then we'll move across to Simon Bryant.
Okay, well, obviously this is the latest data. We have already, as members will be aware, published a response plan for the COVID outbreak. That was approved by Cabinet last month and is now out to consultation with all of our various stakeholders. I think the one clear thing that we know about is that we are still dealing with a rapidly changing situation. And although we have an outline plan and we are following the actions that we've identified in that plan in the 3 recovery pillars, we are well aware that the situation is constantly changing. We have thought that we were in the response situation and beginning to move out of that into containment. But looking at what is happening elsewhere in the country, it's clearly quite a patchwork quilt. And we certainly, I think, our task is to make sure that we are not hit on this island as other people have been elsewhere. And I hope that the information that we're about to get from Simon will indicate where we are and give us a clue as to what actions we might take following that. So
thank you. That's great. Thank you very much, Simon. Can I ask you to come on to the live now and to do your presentation?
Many thanks, Leader. Many thanks, Captain Hutchinson. I will just share a presentation, given the update. As was just previously mentioned, we are in a rapidly changing situation, and so this data is the latest data that we have, which I'll talk through. So, can I just confirm you can see that presentation?
We can.
Great. So this data summarises some of the key data from the Hampshire Isle of Wight LRF and really makes it a dashboard for the Isle of Wight. So we're looking at Isle of Wight data, bear in mind where we are, seeing rises in England. So it's only used for COVID-19 purposes. So I've updated this as of this morning with yesterday's data. So we've had 484 confirmed cases. Apologies, the middle bit. The one new confirmed outbreak, and the weekly rate is 9.2 cases per 100,000. So we see those figures throughout the patch. So when we are looking at figures, we can look at inpatients, so we can see that the number of people admitted is very low, and that's very positive, and we'll see that going forward. With relation to care homes, over the time we've had a number of care homes, and this is since the beginning of the outbreak, with 33 outbreaks in a care home over that time, and that means 2 or more confirmed cases. And then when we look at deaths, what we've got here is the number of COVID-19 deaths, and we can see excess deaths there in the above that kind of green line, and we can see that our excess deaths have come down considerably. We need to be really mindful that we need to look at excess deaths over a longer period of time. So what we're seeing is that increase in cases and deaths is a lag behind that. But we're in a very good position at this point in time. You can see some of those have had COVID diagnoses and others haven't. So we are looking to see where we are in terms of COVID deaths. We also look at early warning signs, and just bear in mind our R value for the South East is 1.1 to 1.4. We do not have an R value for the Isle of Wight. It's just too small a geography to be doing that. So we are looking at that. And then we have a number of early warning signs where we're looking at in terms of 999 calls, 111 calls and such like. So this slide starts to indicate where we are. We saw an increase in 111 calls as the schools went back, and then that's kind of tailed off again. So a number of things that really show that whilst we are in a very good position on the Isle of Wight, there is a number of things we just need to be mindful of in terms of managing the outbreak, in terms of that rate of infection, as I showed in the first slide, going up steadily but slowly, being 9.2 cases per 100,000, and that has in line with the South East, it's going up, and within England. However, with regard to the island, we're in a very good position.
Simon, thank you very much for that, and I hope that people who are tuned into this presentation will appreciate the work that goes on to make sure that we've got that data. I'm very grateful for you to provide that, and that brings us on probably to the actions that we need to take. You're absolutely right, and I mentioned at the start, we must not be complacent here on the island, but it is important that we recognise what actions need to be taken. Claire, I see your hand up. Did you want to speak?
Yeah, I have a question for Simon Bryant, please. Could Mr. Bryant explain what's happening with student testing and students who are still registered at their home address with a GP, and if that would affect our statistics at all?
Thank you, Claire. So with regard to students, so people are tested where they live. However, with new students, it sometimes takes a couple of weeks and actually physically register with a GP practice. So those figures may well then connect back to their residence, which may well be on the Isle of Wight if they've grown up here. So we do look at that very carefully. The numbers will be connected to the Isle of Wight. However, where they actually are residing currently may not be the Isle of Wight.
So we could have somebody who is a new student in somewhere like Nottingham University, but they have still registered their GP as the island, because we all know that, I know my daughter took quite a while to register with a GP when she went off to Exeter Uni a few years ago. So what we're saying is we could have a test result showing as being somebody from the Isle of Wight, but actually they could be a student up in somewhere like Nottingham.
Absolutely, technically, they're still a resident of the Isle of Wight, so they are registered to the Isle of Wight. But however, you're right, they may well be actually living somewhere else. But it's very small numbers, and we look at those on an individual basis.
Thank you.
Thank you. I'll just recognise on board, and I should have introduced him earlier, we've got Councillor Gary Peace. Gary Peace has responsibility for community safety, including the enforcement officers on the island, and obviously will be able to give us an insight and may have questions around the response that we are giving. One question I have, but I'm not sure if it's going to go to Simon or to Wendy. Like a number of councillors, we get regular emails from public on the island asking what the latest situation is with the test centre at Newport. As you know, we've had examples now of island residents being asked to go to test centres off island, and off island residents being offered testing places on the island. Now, I know Wendy will be able to update us on some very good comms that have been done on this, but I don't know if you want to comment on that, Simon, and then I'll perhaps ask Wendy to comment.
I was going to bring in my action section of what we've done. So we've got a really good test centre at Nucleus Cricket Ground, which is really, really good, and we can that's been very well used and appropriately used. You're absolutely right, Councillor Stewart. At the beginning of when the testing challenges came about, that people were directed to their local test centre, which seemed to be a little bit far away from where they lived. That included some people on the island being directed to the mainland and some people on the mainland being directed to the island. We've done a lot of work First of all, nationally, the bit they did was to restrict that. So actually, people were only directed to 75 miles away. Now, that was as the crow flies, which did include the water. And then actually more successfully, Wendy and her team did a lot of work with comms and the ferry companies to really discourage people from booking, both on the island, but also on the mainland. And actually that went down really well. And I think once people understood the rationale for getting testing, and we actually want to identify people who are positive and they may have symptoms, that's worked well. Can I also say it's also been helped by the fact that we have increased the testing options on the mainland in Southampton, Portsmouth and the roundabout, so that people can get more access to testing on the mainland. I can talk about the lab capacity and how we're improving that shortly.
Thank you.
Sorry,
Claire?
can I just add to that? It's one of the few times that people have been grateful for the fact that it's nearly a king's ransom to catch a ferry around here.
Yes. Yeah.
Yeah, interesting. Wendy, do you want to add? I know Simon's got a couple of other action points to mention, but do you want to, just as we're there, just comment on the comms work that has been done, because it's been extremely good, and I think it's allowed us to tackle a problem which we weren't quite sure how we could tackle.
Yes, thank you, Chair. As Mr. Bryan alluded to, as soon as we became aware of the situation, we discussed the issue with the National Test and Trace team and the company who run the testing system. That aside, we recognised that there was a need to get some messages out, not only on Ireland, but more importantly on the mainland as well, because we were seeing a number of people actually coming over to the island and presenting at the test centre, and those were in their tens. I think at the height it was about 30 or 40 that we saw. So we did proactively work on Ireland to give the message about not going to the mainland if you tested positive, and the times of day to try and log onto the system and facilitate a test. But we also worked through our media lead, Martin Neville, directly with media outlets across Hampshire and our neighbouring authorities to ensure that we asked those authorities to give the message out, and their media outlets to give the message out, that if people were directed to the island, not to come, because in effect, what people were doing was using public transport to go to a drive-in test centre. And as we all know, the guidance is that you should not be using public transport to go to a drive-in test centre. That seems to have worked very well. The latest reports were that over the last few days we'd seen none and possibly one person coming from the mainland. We are monitoring that with the staff at the test centre. If we see a change in that, we will reactivate that communications so that that message gets back out there. But I think it does demonstrate that in working together with our partners, both on island and off island, that we got that message out there very loud and clear and very quickly. Thank you.
Thank you, Wendy. And to those people that are listening in from the public, it's this kind of information you'll be able to pick up if you come and listen on the Outbreak Management Board. I'll just go to Gary Peace. Gary, is there anything you wanted to say around enforcement, any latest information? I'm not expecting you to, but I just wanted to make sure we covered that off.
Yeah, thanks, Leader. No, there's nothing really to report other than the fact that enforcement continues as it always has done throughout the entire lockdown period. We are still fortunate in things are relatively low here, or very low actually compared to the rest of the country. But the enforcement teams are on the case and they're watching things very, very closely.
Yeah.
Thank you, Gary. Simon, sorry, Stuart, did you want to speak?
Well, just to comment, while we're talking about testing, and I know Simon has previously told us that there is a lack of capacity nationally in processing the results of the tests. I think it's really important that we have not only an adequate testing centre here on the island, but a very speedy response. And the reason I say that is because most islanders have been coping during the summer months with social distancing, and a lot of our hospitality premises have coped because they've had outside facilities. As we move into the winter, and it's very clear from what's happening elsewhere in the country that this virus is not going to go away anytime soon. I think what is likely is that we're going to have more inside mixing. We've already seen the problems that that's caused in some of the licensed establishments elsewhere in the country. And I have a concern that here, with the kind of establishments we've got, with the inside mixing and the problems that give with the lack of ventilation and fresh air, that if we do get a spike, we shall need to test very quickly and have results very fast. Otherwise, we shall be forced to be in a situation of locking down either individual premises or some of our towns. That's the worry.
Yeah, I think you make a really good point. Fortunately, a number of our premises are really well kitted out with COVID compliance, and I would say to people, if you're not comfortable with the premises you go to and you're not satisfied that they're as compliant as you want them to, don't go there, because you're absolutely right, Stuart. We really do want to minimise the impact without completely locking people down. The other thing we have on the island, which has now gone nationwide, is the coronavirus app, and part of the new app allows people to use the QR code on premises to register if they've gone in, and I would encourage people to do that as well. So both very valid points.
Sorry, Leader,
Yep.
Can I just come in there? It might be worth also pointing out that through the community safety teams, they are putting together some additional training packages for members of the public, for businesses, and so on and so forth. So it's just probably an idea to keep an eye on the Isle of Wight Council website, which will advertise these things. And it's all around, how can businesses put on events and continue to operate safely in a COVID secure fashion. So that is currently being pushed out at the moment.
Thank you, Councillor Mosdell. Claire.
I think Wendy wanted to come in before me, and then I'll come in if that's okay.
Okay, Wendy, did you want to come in and comment? I think on enforcement, particularly, you mentioned. You're muted at the moment. Okay.
Thank you, Chair. It's just an update on the situation with regard to the COVID marshals, which were announced by government some weeks ago. The more detailed guidance finally came through to local authorities last night at midnight. We will be looking at that guidance, and our regulatory services team in neighbourhoods will be linking with Council of Peace and also the police to look at what we do and our proposals for COVID marshals. I think it's fair to say that it is likely that those marshals will not have enforcement powers, but they will be focusing on good practice, preventative information, and giving advice and guidance to businesses. But further work will be emerging on that in the next couple of weeks.
Thanks for that. We did that in the summer with our beach ambassadors, and that proved to be very helpful. So hopefully, as you say, this can be more of a advice and a guidance rather than needing to resort to enforcement, which we have to do if people don't comply. Councillor Mosdell.
Yeah, one, I'd like to thank Wendy and her team for all the information we put out about isolation buddies. But I do need to reiterate this, having had to do 2 weeks quarantine and know how difficult it is and how different it is from actually when we were in lockdown. So I think people don't realise that if you are asked to isolate or you do have to quarantine, you cannot leave your house. So if you have a dog, you cannot go walk your dog, you cannot go do your shopping. So we need to make sure that the general public are prepared for the type of restrictions that you do have to abide by if you are told by the app or you are contacted by Test and Trace to isolate for 2 weeks. It is really, really difficult, and it would have been easier for myself, I know, if I had been prepared for how strict it was and how difficult it was for those 2 weeks. As you know, I've got 3 dogs, and I also couldn't even go and do my horses because my yard isn't attached to my house. So all of that preparation, I wasn't ready for it. So I think having an isolation buddy and having someone that you've already chatted to, just in case you get that call, that could walk your dog or could go and get your shopping, is really important preparation, just in case you are in contact with someone who is positive.
Yeah, thank you for that. The council website does also contain some advice on an isolation plan, and I would echo what you've just said. Be prepared, really. Assume for a moment you've had the call. What would you do? And if you ask yourself that question, you'll then be able to cope, because at the moment we're heading towards the winter months and all of the related areas there. And a lot of people that you may have previously relied on have gone back to work. So we have to really think it broadly. So that's another good point. So I just want to check, Simon, have you completed your action points that you wanted to give us?
If I can just talk about some of the actions we're taking, it's pretty well summarised by many other people around the table. So I just kind of move fast through some of those. So we talked about testing, as Assistant Chief Executive talked about some of the work we did there, but also I'd like to say we were working really hard. The Chief Executive of the Council, alongside all other South East Chief Executive councils, wrote around the testing capacity issue, because it is an issue, and can I say it is improving. So the challenge has been that demand hasn't kept up with supply in the labs. So I'm really pleased that's improving. And I think, as I said, one of the reasons, alongside all the comms, that we're seeing less people travelling to the island for testing is because actually we're seeing increased testing. So that's really, really positive. Just to add to Councillor Peace's point around the venues and the way we're working with environmental health teams around the QR codes, we've done a lot of communication around that to ensure that venues were ready for that. It's a big change in how venues are working, and so that's been really, really positive and very well done. We've done a lot of work in preparing settings and communities and voluntary sector organisations for the kind of next phase of COVID, and preparing for how they can be COVID secure or COVID safe, and that's gone very, very well. Really good engagement. I'm really thankful for the community of Isle of Wight, of how they've taken this on board and moved forward in a way that we would never expected 18 months ago to be doing this kind of work. So I'm very grateful. It's also worth saying the two other key areas in our plan around care homes, and working with the Director of Adult Services, Dr. Carol Tozer, and with Councillor Mosdale, we have worked really carefully and well with our care homes, both enabling them to respond, but also to think about how they can prevent infections, and that's gone very, very well. And education, we saw schools going back in September, and they've done an awful lot of work to ensure that schools can go back safely, and that's gone really successfully. We ran over a number of weeks about 25 seminars and webinars for schools, so actually they could pick the time they wanted. So a number of webinars and with early year settings and colleges to help them really prepare for September. So we did that over the summer, and it has gone incredibly well, and really pleased, and really thank the head teachers and the staff, because it is a real change in the way they're working. And it's just worth saying, finally, every single situation that occurs in terms of, as you said, Councillor Stewart, if there's a case in a setting, we are working with that setting really carefully to prevent further outbreaks, to make sure that the people get that right advice. So that's a letter from the head teacher, or if that's a letter from a setting, we work really closely with them to make sure the information gets out, because, as you said earlier, we're in a very good position on the Isle of Wight in terms of cases, but we need to keep it that way. So it's really important that we stay on top of that and are not complacent. And I think that's going really well, showing really good multi-agency, multidisciplinary working with all of us, working together to prevent outbreaks. So we've done a number of actions and continue to do that on a daily basis with colleagues across many different sectors. And we are, just as I think you mentioned, Leader, making sure our guidance for those events in the calendar coming up are really clear, so that people know what's expected to prevent spread of coronavirus. This is an unusual year for people. We just need to keep that, and we're doing that now, and that will come out very shortly. That's the update of my actions.
Simon, thank you very much, and I know you're giving us the latest information. Thank you for the work not just you but your team are doing. Can please pass that back on our behalf. Councillor Moss.
Councillor Moss will suffice. Just a couple of things for Simon to reiterate. So firstly, in our one-to-one yesterday, Simon and I were discussing how we really need to prioritise flu vaccines for care homes. So if he can talk to people about that and also explain to people the importance of flu vaccinations at the moment, and also to reiterate some of the discussions that we had yesterday about it's all very well people social distancing and being really careful at work, but you won't believe how many people go for lunch with each other and whip their masks off and sit down and have a chat. So if Simon could just reiterate a couple of those flu vaccines and those importance of not forgetting some of those important messages.
If I can start with that second one, Councillor Mosdale, because I think that links onto and then I'll talk about flu. You're absolutely correct. I think what we're finding is that workplaces, the council, the NHS and other workplaces are doing really well and managing social distancing in a more formal setting. So we plan our meetings, if we have to have them, we plan our workplaces. And then sometimes we perhaps relax a little bit on the way home or at lunch, partly because it's really nice to see each other. And we've seen a number of outbreaks around the country where that has happened. And it's really important to remind people that actually think about how you manage social distancing in all those different settings. As you say, Councillor Morris, so when you go for lunch, when you get in the coffee queue, if you're in a meeting, actually make sure it makes the queue look incredibly long, but actually stand back and don't go next to your friend, because we can see that's how it spreads. And it's really important. We're reiterating those messages because we have seen that around the country occurring in different outbreaks, and I'm really clear around the country. We've not seen that on the Isle of Wight, but I have seen it elsewhere.
Yeah.
Simon, thank you very much. Stuart Hutchinson.
Can we talk about the flu first?
Well,
Okay.
it's all about it can be about flu. I have a query about the hospital capacity. I think I know the answer from looking at the slide you've given us. Infections to hospitalizations. I can see that although we've had a little bit of an increase, I'm assuming that our capacity for managing COVID patients in intensive care locally is still more than adequate for the number of cases we're seeing. So it's just reassurance on that aspect, please.
Absolutely, Councillor Hutchinson. We're working very closely with the hospital, both on their current capacity and understand that, as you say, we're in a very good position and they've got the right capacity there. But also, as we did in the first wave, really monitoring that very closely so the hospital can set up its emergency procedures should it need to. It doesn't at the minute, so we're ready for that. So we're doing both those things. But at the minute, we're in a very good position with regard to the right kind of beds that are required, and we have very low admissions to hospital across the southeast, so it's very low.
Okay, thank you.
Thank you for that. Claire, did you just want to cover something else?
I talk about flu.
Yes,
Yeah,
flu.
sorry,
Yeah, Councillor Morsdale is absolutely right. Flu vaccination this year is as important as always, but even more important because we have another respiratory disease circulating in our communities which we didn't have before. So that's really important for the health of ourselves, our families and our communities, but also, as Councillor Hutchinson said, hospitalisations, because we know that some people get very sick with flu, and what we need to do is prevent hospitalisations, and flu vaccination is a really, really good way of doing that. So yes, please do, wherever possible, get a flu vaccination. Some people will be eligible through various eligibility criteria, such as being over 65 or have a long-term condition, or if you're of working age, you can purchase one. They're extending the criteria to under 50s, over 50s later in the season for flu vaccinations. It will be really important to keep promoting that, and as Councillor Morsdale said, we are focusing on those areas most at risk from the consequences, such as care homes and older people. So that's something we are doing, and we need to promote that. It's also worth saying some of the measures we're taking around coronavirus, around social distancing and really good hand hygiene and wearing a face covering will also prevent flu. So actually all those measures together, including the flu vaccination, will actually mean we should be doing well with regard to flu, but we are monitoring that very closely in terms of the number of cases in our community and the hospitalisations. And for those who are parents, there'll be the school vaccination programme has extended this year. It was from age 2 to year 6 at school, so age 10 or 11. It's now gone up to the next year, so year 7 at school, so that's ages 11 to 12. So we've expanded that programme as well.
Thank you for that. A number of councillors have received messages about flu vaccines not being available at local doctors or pharmacies, etc. What's the island-wide picture on that?
So similar to the rest of the country, there is some challenges in the delivery of flu stocks. Different groups of people, so the over 65s require different stocks to the under 65s and the children. So what we're asking GP practices to do is to plan their flu clinics when they invite people in line with the stocks they have. I understand that it's getting better, but it's still in a place where we are needing to ensure that people, when they're called in, they get their vaccination, and if there's a little wait, they'll wait for the next stock to be delivered.
Excellent, thank you very much on that. I just want to echo again, if you're out to a restaurant, remember it's a maximum of 6 people, still socially distance where you can, wash your hands, keep your distance, and wear a face mask when you get up from the table. I know we repeat them a lot, but actually it's almost getting it in your mind as normal working practice, and then people will just do it as a matter of course. So I think the other item on the agenda now is going to be to complete the communication update. I'll pass over now to Wendy, and then I've got a couple of questions, Wendy, on that as well. So Wendy Prera next.
Thank you, Chair and members of the board. Members, I'm going to take the paper in front of you as being read, and you will appreciate that at the point of time at which the papers were published, this was the latest information. But as Simon alluded to, things are changing very. We have government advice being updated and changing rapidly, and therefore our response to that and our communications and engagement opportunities changes as well. So I'm going to give you a verbal update in terms of the position that we're currently at as of this week. So if you bear with me a second, there is a considerable amount of activity that the team undertake on a regular basis, but they don't do that in isolation. They do work collaboratively with services across the council, most obviously our regulatory services and our public health team as well, working very, very strongly with Simon and his team on communications. But also we work with our partners as well. So we work with our Category 1 respond partners, which are the police, the NHS Trust, the ambulance service, and our other responders, but also our partner agencies that form part of our kind of wider multi-agency view of the island in terms of managing COVID. We do have a considerable amount of ongoing work with the media. The media are incredibly engaged in understanding and helping us to manage the COVID situation by promoting and sending messages, and have taken a very comprehensive approach to doing this for the island, and we are sharing messages with them on a regular basis, and that will be ongoing as we progress through the various stages of how we're dealing with COVID. We have a considerable amount of media coverage on a regular basis, and Councillor Mosdale's already alluded to the self-isolation toolkit coverage in particular, but I think there's still more that we can do on that to really help people understand the importance of preparing for needing to self-isolate should they either unfortunately contract COVID or have contact with someone who is positive. Councillor Peace mentioned the fact that we were putting in place some sessions for various groups, and we have a session on the 13th of October specifically aimed at the voluntary and community stakeholder engagement sector. That will be run by regulatory services. The invite is out on Eventbrite, and we have put out a media release, and information is available on our website and on our Facebook page. We've already talked quite considerably about the testing comms that we've undertaken, and as I say, we're keeping a watching brief on that issue, and we'll ramp those messages up should we see a change in any numbers accessing from the mainland. We continue our work on preventative messaging in particular, because throughout the whole COVID pandemic, it's the preventative messaging, that the messaging about the actions that we can all take as individuals that has really made a difference on Ireland. And it's been spoken about by members this morning, and I know that our chief executive has mentioned it, and Simon, Mr. Bryant, has mentioned it this morning. We are incredibly grateful to the hard work of every member of the community on the island, because it is our own personal hard work that we put into keeping socially distanced, washing our hands, looking out for ourselves and our colleagues, that has helped to keep the rate of infection low on the island. And I know it's very easy to get weary with that process and to become complacent, but throughout the messaging that we're currently developing, we are focusing on why now more than ever it's equally important to do what we have previously been doing. We have seen numbers raising throughout the UK, and we have seen restrictions being put in place at a local level in response to that. And we want to make sure that wherever possible, we don't get into that situation. So that is what our communications will be planned at doing. This week, yesterday, we launched a residents e-bulletin, which is a further channel just to simply provide smart and up-to-date information on what's happening with regulations or messages that we want to get to members of the public. Information on that will be available on our website, and I would urge members of the public to sign up to that newsletter as an additional channel to receive information. I know that the leader will want to mention later, but we are also considering and pulling together a residents mailing to go out in early November, linked with the work that we're doing through the ICP, the Integrated Care Partnership, to provide further information and advice and support to the community. We've been developing our approach to geo-targeting, which is a digital form of messaging that will support the council get messages out to the wider community should we find ourselves in the situation of an outbreak and needing to ensure that people receive information timely and quickly. Our hashtag for our whole messaging around COVID is now Keep the Island Safe, and we're developing a microsite, www.keeptheislandsafe.org, which will provide the basis for our geo-targeting work. We have an ongoing programme of work for social media, which includes signposting self-isolation, information about testing, new and updated information as it's presented to us by government. And we know that the Test and Trace app has now been launched on the 24th of September as a national app, and over 14 million national downloads have already been undertaken. We have no further action as a local authority or local council to undertake in terms of the app development itself. But as Mr. Bryant alluded to, we've been working with businesses in relation to the QR code and showing the QR code, which is now, of course, a mandatory requirement for local businesses. We've developed an internal learning and development module for staff in the council, which we will be launching within the next couple of weeks, that is about our outbreak management process. And we are continuing to amplify the preventative messaging within staff communications for the very reasons that we've already set out in the discussion that we've had this morning. We publish our COVID-19 data on a weekly basis. As you know, COVID data is updated far more frequently than weekly. So it was useful to have the additional and updated information from Mr. Bryant this morning, but we will be continuing to update our published data on a weekly basis. And then, of course, this is the first of our local outbreak engagement meetings, which is taking place in public, and gives us the opportunity to hear from yourselves as members in terms of the feedback that you're getting from your constituents, any worries that are being raised with you, and any questions that are being raised. So that's my update on the communications process. I'm happy to take any questions on that.
Yeah.
Stuart?
Thank you, Chair. Not a question so much as a comment, and I think it does illustrate the value of public meetings such as this, because those of us that are involved in the COVID responses in whatever way are generally fairly well aware of the work that's been doing. But from the descriptions that we've just had from yourself and from Mr. Bryant earlier, what we can see is that the media messages are probably about 10% of what's going on, and then, like the iceberg, a lot of other stuff is probably invisible to the public, but is an indicator of the huge amount of work that is happening. I don't know about other members, but simply because of the work that we're doing and the messages we're putting out, I am not getting from constituents more than a very few emails with queries. And I know from previous experience, if we get things wrong, you get a flood of emails. So I think in that way, there is an indicator that we are getting most of it right, and we need to keep our eye on the ball to make sure we continue to do that. So just a thank you really to the people behind the scenes that are doing all of that hard work.
Yeah, thank you for that. Gary, did I see your hand up?
Yeah, please. Thank you, Chair. Wendy, I know you mentioned there's been 14 million downloads across the country. Do we have any idea what the uptake is for the app on the island?
Thank you, Councillor Peace. I don't have any updated information, but that's certainly a question that I can send back to the national team for confirmation. It was something that very early on with the second round of testing, we received some very low-level data on, but yes, we will take that back as a question. Thank you.
Thank you. I know because I know we had a really high uptake with obviously when we were the pilot. It'd be interesting to know what the uptake is now. But thank you.
So thank you for that, Gary. So I think we've come to the kind of concluding summary end of this particular meeting. Wendy, I was just going to try and check when our next meeting was. I don't know whether that information is available through the system. I wanted to just really leave a statement at the end. We are in worrying times, and I think the whole community appreciates that. But what this meeting has partly tried to do is to reassure island residents that we are doing all we can to keep them safe. We genuinely are. I would say don't take unnecessary risks. It's quite clear that the island residents are being very careful. And when you see the fact that we are one of the, if not the lowest in the country at this time, we're not there by chance. I think we're there because people have been doing what they've been asked. They followed the guidance and they are supporting our island, each other. So I think as long as people can do that, we will get through this together. And I will just say a thank you to Isle of Wight Radio in particular, who on a Tuesday morning allow me to speak through them to the island. We're now using wider means. What we're trying to do is keep the message there so that people do cover safely. These meetings will be monthly, so people will be able to tune in and see what's going on. And as you rightly say, Wendy, we're also just exploring now a letter to every resident on the island, which will effectively be a winter guide, if you like, so that everybody gets this message, because we do appreciate that not everybody is on IT, not everybody's got computers, and we do need to reach out to everybody. So we've had some fantastic work through our community hubs. We've had some fantastic work through the various partners that we work with. But we just want to reassure the island that we're not going to let up. We're not just going to sit and wait. We're going to be very proactive and we will keep people informed. So I just want to thank all the team. This is our first public meeting. Thank all the team. Thank the public for listening in and encourage everybody to keep our island safe. So with that, I think I'll draw the meeting to a close.
All right. Thank you, Chair.
Thank you, Chair.
Thank you.